Hi, my name is Rakshi. Welcome, and we'll have a tour of the Aurora Sinai Medical Center and Aurora facilities. Right now, I'm standing outside our geriatric outpatient clinic. This is where the fun part is. Let's go inside and see. As we walk in, we see our two very favorite, polite, pleasant ladies sitting at the front desk, and they make you feel at home right away. This is where the patients usually enter. We have several examination rooms and in these hallways. This is one of the examination rooms. As you can see, that these rooms are quite good. They are spacious. We don't feel cramped. We have basically everything in each room. All rooms are very well equipped, especially for our geriatric patients. And moreover, for the convenience, if you want to pull any records on patients, we have computer terminals in each of the rooms. As we walk down further this hallway, this is where our medical assistants are. We have a very good communication system in this clinic. We correspond to each other with the physicians as well as the nurses and medical assistant via walkie-talkie. We don't have to run to look for them if they are busy with other patients. So they sit here, they have their own computer terminals, and we just give them the instructions of whatever we need on the patients, and they just order those. These are also some of the examination rooms. This is one room which we use after we have seen the patient. If we want to review any records or if we need some data from the computer, we also have some other teaching programs on the computer that we have easy access to. Right across the hall from the examination rooms is the room where our attendings usually sit, and there are several halls down the row. And these attendings are always available when we are in clinic, and they are very willing to teach us, and they precept us in clinic. If we have any problems, they come and see the patients also with us, and we discuss every patient in detail along with the management part also. Now we are entering this area which is on the other side of the clinic, and it is called Heifetz Library. This is where we spend our most of the time. We have noon conferences here. We even have this web conferences which are very, very useful. We get calls from different other facilities also, and speakers from other facilities also deliver their lectures. We can all attend those. We have a wide range of journals which are archived over here. Besides these, we also have library downstairs for detailed references. We have a computer at one of the ends with some sound files for education purposes. We refer to a lot of those sites and refer to all those sound files and lectures. So this is a very helpful place. We spend a lot of time in this area. Besides this, since Aurora is located in the heart of the city, the view is beautiful from here. So it looks very pretty in summer, winter, I would say all 4 seasons. We can see the traffic. There is so much light during the later hour of the day, and it's a very peaceful place to be with. I spend a lot of time over here. Now we are heading towards the 3rd floor of Sinai Medical Center. This is where we are mainly located at. This floor has been awarded the Ace of Hearts program unit because of its geriatric population-friendly environment. If you notice, we have those railings, very pretty pictures on the walls. The floors are non-glare, which is very, very patient-friendly. We have several of the patients' room in different pods, and each pod is equipped with a computer terminal. So after seeing the patient, we can have easy access to computer for labs or anything that we need. Then down the hall, on the other side, we have this family break room, education conference room, several of these. It is very nice. It's they have very warm, welcoming pictures on the walls. We sometimes have family conferences in these areas too. If we have a bigger number of patients' family, this is also equipped with television. There's microwave. If families want to bring their foods, they can warm it over here. Right now I'm standing in front of the nursing station at the 3 South, or our telemetry unit, where our stable but critical patients are admitted, and we have monitors over here, and they go on if patient needs cardiac monitoring. Nurses are available here. Right now we are in the physician's working area, which is located just behind the nursing station that we just visited. As you can see that there are several computer monitors. Again, easy access to patients' data, medical records and medical information, and it's very quiet and peaceful in this area. Right now we are in one of the patient's room. As you can see, these rooms are very spaced. It's not congested. Patients feel very comfortable in these rooms, and of course they are our patient-friendly rooms. Right now we are walking down the ACE unit, which is again my favorite unit. This is where all the activities take place. On my left side are the patient's room, and on the right side is the nursing station. Also, there are several computer terminals that we have access to. This place gets very busy in the mornings, but this is a very nice place. The nurses are very friendly. The whole staff is very good over here. We also have all the rehab staff in this floor, because as you can see down the hall, that door leads to the rehab unit. Most of our patients do go to rehab for the inpatient therapy, and also they work closely while our patients are on ACE unit. Now I'm going down the hall to the break room, where patients and their families can have lunches, dinners. We also have television and sofas and computers in this room for the families. Sometimes we have family meetings in these rooms with our patients and their families. In general, this is all very home kind of environment over here. We have conferences every morning, which are called the OFT rounds. Patients' decisions about their care and discharge planning and all is taken care of in these rooms every day. And it's a very good learning when we work very closely with the social workers, case managers, pharmacists, patient nurses, and other physicians. And we all sit together around one table, and we discuss each patient in detail in these rooms. This is the main part of our training. It is called the ACE unit, which is also the short form for the acute care for the elderly. As you can see, the doors lead to the hallway, which leads to the rooms where the patient's care is taken care of. And as you can see, this is very, very senior patients friendly place with all those amenities that a geriatric patient would need. Now we are in the main lobby of the hospital. As you can see, it is very pretty. We have assistance right from the door. As soon as patients enter this building, we have valet services for parking, and then we have help to provide them guidance and assistance in their directions. I think I gave a brief overview of our hospital, but once you will be here in person, you will say that I did not really do the right job, because it is much more better and much more comfortable, warm and welcoming in person. And I hope you will be here soon to experience this.